welcome here today. We're here today as 9 peak nursing and midwifery organisations to give a clear ask to government in the upcoming election. The 9 peaks stand united as one to actually advance the care in the health system in Australia. And we have 7 clear asks that have low or no cost to the delivery of great healthcare and better access to healthcare for all Australians. And we thank you for being here today. The 9 peaks are standing represented behind me, and they'll be speaking as well. And we have 7 clear asks to improve the health system in Australia. Nurses and midwives are 1 in 25 of all registered Australian voters, and they represent 54% of the health workforce in Australia. It is integral that they are used well by the health system, and our 7 asks today make these very clear to both government and policymakers so that Australians can get better access to healthcare. Our 7 asks run across a number of areas and benefit rural and remote, midwives, mums, nurses, all working together to give better health. Nurses are a significant part of the solution to the health crisis that we have in Australia. And don't get me wrong, doctors have their place in the system and we are not challenging that, but it's integral that this 54% of the health workforce is used well and used to their full skills, experience and capability to improve the health of Australia. And that's why we're calling on our political leaders to adopt the 7 key asks that use nurses' skills to change our health system for the better. Nurses should be prescribing medications, leading more clinics, and getting patients to specialists without unnecessary delays. And they can do this more affordably and in greater numbers than any other workforce in healthcare. Nurses and midwives are the best geographically spread healthcare workforce in the country. And they can do this more affordably and in greater numbers than any of the other health workforces in Australia. Our asks are clear for political leaders, and they can take these right now. Most at no or minimal cost to the taxpayer. Right now, for example, our political leaders could change the laws to allow registered nurses and midwives to refer directly to specialists. This would reduce delays in care and get patients to the care they need sooner. This would reduce waiting times and cut costs and ensure patients receive the care they truly need. Other changes that could be made include getting more nurses and midwives into general practice, especially in rural and underserved areas where they could be helping increase access and access to the healthcare that is so needed in those communities. And importantly, making sure that through the workforce incentive payment that they are able to work to their full scope of practice rather than actually doing administrative tasks or taking out the bins, using these highly trained, skilled professionals in the manner that we train them for to serve our health in Australia. Healthcare in rural and remote Australia is in crisis right now. And with waiting times to see a GP at record levels, we need to improve on that. And that's why we believe that nurse-led clinics should be funded in order to make sure people can get that timely access to care so that we don't end up with people unnecessarily being in hospitals. That's why we're calling for funding to support more nurse-led care, more nurse-led clinics, particularly in those rural and remote areas. We can keep arguing about out-of-date models that we use in Australia, or we can actually start working on the solutions. And that's why we're calling for those 7 key asks as the largest workforce in Australia, and that's why these 9 peaks are here together. I'm going to introduce you to some of the leaders of those 9 peaks who will talk in brief detail about those 7 asks, and I'm going to call Annie Butler from the Australian Nursing and Midwifery Federation to talk a bit further.
Thanks, Ken. Annie Butler, Federal Secretary for the Australian Nursing and Midwifery Federation. Right now, we know that cost of living pressures, that's the key issue for Australians across the country, and we know that a lack of timely and affordable access to health care is one of the big pressures. So that's why I'm here today, joined by some of our nurse members and with my colleagues, to provide you with some of the solutions to making sure everyone in the country can get access to timely and affordable health care. and we have the solutions. Together, we represent more than 350,000 nurses and midwives across the entire country. Our members work in every sector, in every region, across every facility. They know where all the pressure points are, and they know the solutions. We have the solutions. I'm just going to talk about two of them, and my colleagues are going to tell you the rest. They're simple. They just make sense. If we allow nurse practitioners and endorsed midwives to refer directly to specialists, it saves time, it saves money, and it saves so much stress, most importantly, for the community and for individuals who are trying to get access to healthcare. If we also allow nurse practitioners and midwives to order diagnostic tests directly, again, it saves time and it saves money. If we can just trust the expertise of nurses and midwives, we know that everybody will benefit.
Thanks, Annie. I'm now going to call on Karen Booth, the President of the Australian Primary Healthcare Nurses Association, to talk about how nurses and midwives can be better used in general practices.
Thanks, Ken. Karen Booth here. I want to talk about the work incentive payment. We would like to see that strengthened, the grants that go to general practices in particular to help support employing the nursing workforce, but we want to see that strengthened, but we want terms and conditions with that. We can't just keep going on the same almost without any, sorry, I've just lost it. Can I start again? Sorry, okay. I'm here to talk about the work incentive payment. We'd like to see terms and conditions with that. Currently, those payments go to practices, and there's no responsibility of practices to use their nurses to actually support nurse-led care, to actually support health checks, to support those preventative checks that we want. We'd like to see that payment expanded out to cover 7 health professionals, but what we really want is to make sure that those payments are used for the intent and purposes for that they were created. We want to see nurse-led care, nurse-led clinics, and most importantly, improved access to care. We talk about in health reform the right patient, the right care, the right treating person, but in reality that doesn't happen. It needs to happen. Thank you.
Thank you, Karen. I'm now going to ask Adjunct Professor Catherine Zeitz from the Australian College of Nursing to talk about the kiosk from their perspective.
Thanks, Ken. Hi, my name's Catherine Zeitz and I'm the CEO of the Australian College of Nursing. I am here with my colleagues from the other 8 peak nursing organisations. Nurses make up 54% of the health workforce in Australia. We are the most geographically spread, as you've heard, and we are the most trusted of health professionals. Our ask from this particular group is to make sure that nurses have the scaffolding so that they can practice to the level of experience and skills and capability that they have. I want to talk to you about Melissa. Melissa is a registered nurse coming out of our public health system who was frustrated at the challenges that people had declining in their health and long waiting times to get the right care at the right time. Melissa set up a clinic for her local community to manage chronic wounds. Melissa now employs 30 staff providing chronic wound care to the community at Port Macquarie. But the travesty is it is not a model that is funded in our traditional funding systems. She has to spend many, many hours securing funding from the public sector, from the primary care sector, from Medicare. Nurses access less than 1% of Medicare funding. We think there needs to be more alignment with regulatory and legislative frameworks so that nurses across Australia can work to the top of their licence to not only improve access for their communities, like the community of Port Macquarie, but also that they help reduce cost of living crisis. Thank you.
Thanks, Catherine. I'd now like to welcome Helen White from the Australian College of Midwives.
Hello, my name is Helen White from the Australian College of Midwives. Midwives are experts in sexual and reproductive health care and maternity care and supporting women. And despite the government's investment in women's health, midwives still do not have access to MBS items for much of sexual reproductive health care. This includes contraceptive counselling, this includes LARC insertion and removal, this includes abortion training. So what we would like to see is that we have more access to MBS items for sexual and reproductive health care, to provide more access to women for sexual and reproductive health. Yesterday I was talking to one of our colleagues in the goldfields of Victoria, Sarah Grundy. She runs a midwife-led sexual and reproductive health clinic in rural and remote communities, and she does not have access to MBS items for contraceptive counselling, for abortion care, for pelvic pain care that these women are looking for, and this is what we need. Also in birthing on country settings for our First Nations Australians, we also need to have MBS items for them to be able to access abortion counselling, contraceptive counselling, early pregnancy loss counselling as well. We do not have an MBS item for any item outside of pregnancy. So it's really important that we focus on that and that the government funds MBS items to enable midwives to work to the full scope of practice. And this is what the Australian College of Midwives is calling for today. Thank you.
Thanks, Helen. I'd now like to call on the CEO of Katsanam, Ali Drummond.
Thanks, Ken. Hi, everyone. I'm Miriam Daureb, Willoughby man from Zenat Kes, and I'd like to respectively acknowledge the Ngunnawal Ngambri people. CEO of the Congress of Aboriginal and Torres Strait Nurses and Midwives. We are the national peak for Aboriginal and Torres Strait nurses and midwives here in Australia. Our job is to advocate largely for the increase in Aboriginal and Torres Strait nurses and midwives in this country, and advocate for more influence over healthcare delivery. Today we stand in solidarity with our partners from the other Nursing and Midwifery Peaks, calling for action on our 7 asks. Action 7 proposes the implementation of primary healthcare workforce development strategy for nurses, nurse practitioners and midwives. This proposed actions includes an investment in Aboriginal and Torres Strait Islander nursing and midwifery primary healthcare workforce, which requires ensuring culturally safe clinical placements, transition to practice programs and professional development opportunities. Aboriginal and Torres Strait nursing and midwifery primary healthcare leadership is evident in our historical contribution to the growth of the Aboriginal community-controlled health sector, starting with Katsanam's founder, Auntie Dr. Sally Gould, who was the first nurse employed in the first Aboriginal medical service in Redfern, Sydney. More recent leadership examples include growth in the midwife-led birthing on country models, as well as the nursing-led chronic disease models of care. Katsanam believes that all 7 actions can enable the growth of the number and nurture the innovation of Aboriginal and Torres Strait Islander nurses and midwives. Furthermore, the 7 actions can optimise the positive contributions that all nurses and midwives can make towards closing the health gap between Aboriginal and Torres Strait Islander nurses and midwives. Thanks.
Thanks, Ali. And finally, we have Professor Anne Bonner from the Council of Deans of Nursing and Midwifery.
Thank you. I'm here with my fellow colleagues and peak organisations to advocate for the scope of practice review, which is before Parliament. Universities are the ones who prepare the nurses and midwives for the Australian workforce. But there are barriers and challenges to preparing the workforce there through both the education and health sectors. Now we have some good initiatives coming through the Commonwealth PRAC payment, which will start on the 1st of July, and we absolutely welcome that. That will help prepare our nurses and midwives for the future Australian population to serve them. Universities also prepare nurse practitioners and endorsed midwives to practice in the examples that you've just heard about. And so at the Council of Deans of Nursing and Midwifery, we are working with our colleagues to support a quality nursing and midwifery workforce that can provide good, safe and quality healthcare for all Australians now and into the future.
Thanks, Anne. And I made a mistake before. We, of course, have Adrian Armitage, CEO of the Australian College of Mental Health Nurses, to round out our statements.
Thank you very much, Ken. Today it's all about trust and respect. It's about nurses being the solution, midwives being the solution. We're talking about working with our colleagues in a multidisciplinary approach. So I'm talking about three things today, three of the actions. First one's going to be nurse-led clinics. For a long time, nurses have been undermined in the respect in the marketplace, and we need to talk about how we can lead these nurse-led clinics. Mental health nurses in particular are very supportive about this, and our 26,000 mental health nurses in the country are fully supportive of this particular program. They're very successful in the ACT where we are today, but they could work absolutely everywhere around the country. So we're talking about remote and rural communities calling on those nurses. The second point I'm going to talk about is GPs. We're working with our GP colleagues in a trusted relationship. So let's go and call on the workplace incentive payment program and ask our politicians at this coming election to go and support these programs, to look at more item numbers for nurses and midwives right around the country. Nurses are the solution in this space when we've got declining GP numbers. And the final area I want to talk about is education, empowerment of our nurses and midwives. We have a chronic need for investment within the university sector to support our academic colleagues, to have the throughput for more and more nurses and midwives to come through the system. Nurses are the solution, but they have to be empowered going forward. As Australia is demanding more of our health sector, please remember, nurses are the solution. Thank you.
Thank you, Adrian. So just to conclude, the 9 peak nursing and midwifery organisations stand here today as one, united with 7 clear asks for how we make Australia's health system better and stronger, creating more access economically to make sure Australians are healthier. Nurses and midwives represent 54% of the entire health workforce and 1 in 25 of registered voters in Australia, and we stand together, united, for change in our health system. I'd like to take the opportunity for any questions from anyone here.
Do you have anything tangible that you could offer, and if so, how much would that cost?
So our 7 key asks are very tangible. They're largely no or low cost, and they stand as part of recommendations from multiple reviews that have been conducted in Australia over the last 5 years. Importantly, the nurse-led clinics, you've heard that as a very clear theme, which we know will open up access to great healthcare across the board, and particularly in rural and remote areas. For an at-scale trial or pilot of that, we would estimate that at about $500 million, which stands up against other estimates from government agencies previously.
And what do you say?
Can I just add to that question? Just because everyone always asks about the costs, we don't talk about the cost savings. So a number of the measures we're talking about are going to reduce duplication. So when I talked earlier about access to referral to specialists, access to diagnostic, what that means is instead of a nurse practitioner seeing a person, that person trusts their relationship with the nurse practitioner, but they have to send them down the road to a general practitioner now to get those things done. They could be doing it right there, right then, directly, and the person is doing it with the person they trust. It saves the extra cost on the system and on the individual who doesn't get the timely access to care that they need. We've got to remember the cost savings.
What about the claim that this could actually, having more nurse-led clinics could fragment care in the system?
One of the things that we know, and I have 3 people here who are from the nurse-led clinics, the nurses, advanced practice nurses who work in the nurse-led clinics in Canberra right at the moment. We know how successful their model is. They see hundreds more patients a day. Those people trust them. And what's been set up is that those people, the community gets to know these nurses, the people standing here with me, just as they would the relationship with their general practitioner. And our nurses, they build the relationship with the general practitioners in the community and with the hospital networks so that they're connected. And in fact, general practitioners actually refer people to our clinics. So what we know is that chronic disease management is not funded well at all at the moment, and we need significant policy reform. The nurses who work in general practice are perfectly placed to manage chronic disease across the board and for people, but it's not funded. If we could, we would reduce fragmentation in care. We'd allow proper continuity of care, which is what you need for proper chronic disease management.
Shouldn't it be the GP in the end, though, who is the one that is at the heart of this system and that is leading these clinics? The GPs have said they support nurse-led clinics as long as they are leading them.
Before I move on to that, I'll go back to the fragmentation of care issue. We have a national electronic health record that GPs, nurses, hospitals, specialists, allied health can all contribute to, and that is a connection point. You can see a doctor or a nurse in New South Wales, they put it into your electronic health record. The doctor in Victoria, when they cross the border and have a health issue, they can see that information. They can see a nurse practitioner in the urgent care clinics who are uploading to my health record. Then the regular GP can see that information. Apart from that, there is already a well documented pathway for reporting back to people's GPs. So that's there. And you can't fragment care if you can't get care. And I think that's a really important issue. Yes, GP clinics are willing to see more people, but people can't get appointments. So someone has to pick up the slack. Someone has to see patients who can't afford to pay, who can't get access to the GP, and we want to keep them out of emergency departments. So I think that's the most important thing. GP-led care, most people have a GP. 80% of the population see GP every year. What we need to be is one big connected system and talk to each other. If we talk to each other, fragmentation is gone.
I think we'll call that to a close now. Once again, nursing and midwifery stands together as one for change that's positive for our health system. 1 in 25 voters are nurses and midwives. It is the best geographically spread profession in Australian healthcare, and it represents 54% of the entire health workforce. Nurses and midwives are the solution to the challenges we have in our health system today. Thank you for attending.